most effective. Right now, we're currently engaged in a campaign for felon assistance. Felons can't get jobs. Felons can't get housing, even after they've completely served their time. I've completed parole, probation. I've gone to college. I've completed 3 job readiness programs. I've been to college and gotten certificates, and I can't get a good job. I'm still serving time.
All right, so our legislation is a part of a larger umbrella which most of the organizations have spoken to. We're looking to re-enfranchise the disenfranchised. Voting can help to, possibly help to curb recidivation, allow people to get back into the system, give people a reason to go down to Annapolis. And we're also asking that the correctional system, upon release, informs these men and women that they can vote, because many of them don't know that they can vote upon coming home. So we have a table straight in the back. If you go out these doors, Perry and Robinette, raise your hand, Robinette, will be back there. I'll be back there afterwards. Please pick up our information. Thank you for your time.
Next is Maryland Disability Law Center.
Good evening, everybody. I'm Virginia Knowlton Marquez. I'm with Maryland Disability Law Center. We advocate for people who have all types of disabilities, people of all ages throughout Maryland. We try to be active in a lot of areas: fair housing, special education, school discipline, school to prison pipeline, juvenile justice, access to transportation, to health care, to mental health and developmental disability services, transportation. We also try to be active in Annapolis and analyze all the legislation for impact on people with disabilities and inform public policymakers appropriately. We do a lot of our work in coalition. A lot of the people that are here, we could use your help. We also have a secret weapon, our answer to the high-paid lobbyists who represent the money interests. We have Lauren Callens, who transforms herself into a superhero every spring and is down in Annapolis, and she's right there. Lauren.
Not high-paid lobbyists.
No, she's not. And she's worth every penny of it and more. So what I decided to do with the limited time that I have is to bring up to date on an issue that we've been working on for a while down in Annapolis, the forced treatment of people who have a mental health diagnosis, involuntary outpatient commitment, or as they call it in Maryland, OCC, outpatient civil commitment. So this is a policy proposal that we are not in favor of. It proceeds on the notion that you can identify a group of people who lack insight into their own need for mental health treatment and force them, get a well-meaning judge to require them to do what we know they need to do, which is take their medication, and that will fix a problem. So we introduced an alternative proposal last year, House Bill 1267. You can look it up from last session, and that would have provided an alternative. And if you're familiar with assertive community treatment, that's sort of the basis of the model, but it would have required enhanced and comprehensive services to be offered to people voluntarily, required discharge planning, data collection, holding the system accountable for taking care of people instead of punishing people for the system's failures. And then there was also a forced treatment proposal. So ours had wide support. The forced treatment proposal split the mental health community. The legislator said, go do a work group and come back next year. So HB 1267 was amended to create this work group, and the work group was supposed to decide what Maryland should do based on evidence, based on the potential for racial bias, based on health disparities and other factors that were to be considered. So the work group was convened by the Department of Health and Mental Hygiene, and on the very first meeting, the department said, we're gonna do outpatient civil commitment in Maryland. So it wasn't whether or if. This is what we're doing, and the charge of this work group is to figure out what this bill is gonna contain. So of course, Maryland Disability Law Center objected to this, Mental Health Association of Maryland objected to this, On Our Own of Maryland, which is the mental health consumer group, statewide group, objected. So the department has issued its report, and we have issued a dissenting report that you can find on our website. Our brochures are out on the table out there if you're interested to look at this. Former managing attorney, now attorney, Laura Kane, that was her decision to do. Mental health attorney wrote this report, and it's just a tour de force. She did a really good job. And so we expect that this conversation is going to continue this session. So if you're interested in it, please be in touch with us. But a couple reasons why I'm telling you about this. I mean, it is just extraordinary for a society to tell people that they're going to be enforced to take substances that alter their minds and their experience of the world, and it needs to be done with careful consideration, and we're very disturbed that that careful examination was avoided. Specifically because at least 6 in-depth systematic studies of the research on involuntary outpatient commitment show that it is not more effective than voluntary services, and where it has been implemented, New York, for example, blacks are 5 times more likely than whites to be under a court order. In North Carolina, 22% of the population is black, 2/3 of the court orders are black folk. So there's a lot of problems with this, and so I wanted to let you know about it, and if you're interested, please be in touch. Thank you.
All right, next we have Maryland Working Families.
Good evening, everybody. I want to thank you all for coming out tonight, and thank you LDS and Associated Black Charities for pulling this together. This is probably one of the most important meetings we'll have in Baltimore this year. And I say that because there's so much energy right now on the streets. So many people are paying attention, and there's such a danger of losing the attention and the passion and the energy that can make real change in Annapolis and make real change for all of us. There's a real danger of losing that if we can't figure out how to direct that. So thank you for coming tonight and for listening to the advocates. My name is Charlie Carter. I'm Executive Director of Maryland Working Families. We are an independent political organization that's focused on building political power to hold elected officials accountable, and passing policy that promotes economic security for working families. So as Delegate Braveboy and Delegate Carter spoke about the need to come together, and as Davon talked about the need to take the people most affected and pair them with the advocates, Working Families, Maryland Working Families, is the organization that brings those people together. We run a full-time field program that is out daily trying to identify storytellers, people who are experiencing the real need in Maryland, and then bringing those storytellers to Annapolis so they can make the legislators too often, the ones they pull the lever for, listen to what is really going on and then do what it is that they were elected to do. So last year we led the Raise Maryland Coalition that raised the minimum wage. We didn't go far enough, fast enough, but we're going to be working on that. You heard Melissa talk about paid sick leave. We're part of the Working Matters Coalition. We will be bringing our expertise to that. In addition, we are looking at a fair and equitable budget that prioritizes the needs of working families. meaning we're going to be watching for cuts and making sure that they're not cutting Baltimore City so that they can give money to another county, that our schools keep the funding that they need, that poor children who need money to eat, who need food at school, to make sure that's not cut, and other services that are important for working families. We're also pushing a Fair Work Week initiative that improves the rights of people at work, which include things like earned sick leave. We just heard about paycheck fairness, that if you're a woman, you're not making 85 cents for every dollar that a man doing the same job is working. Maryland has the ability to pass its own bill. We'll be pushing that this year. Paycheck fairness, reporting pay. Too often in this state, for too many people who work in the service sector, they're told that they have to report to work, and then while they're on their second bus on their way to work, they get a call saying, oh, don't report to work. Maryland is the only state that doesn't have, the only state from North Carolina to Maine that does not have reporting pay. So this bill would say, if they cancel your shift within 4 hours of the time you're supposed to show up, that you have to be paid a certain number of hours, and limits the number of shifts that can be canceled on you over a period of time. Right to rest is another initiative we'll be pushing. That means that you can only get a certain number of back-to-the-back shifts, or you can't be assigned a shift that ends at 10 a.m. and then be scheduled for a shift that starts at 1 p.m. That they have to give you a certain amount of time that you can go home, that you can get some sleep. And finally, we're going to be looking at closing loopholes that allow bad employers to steal wages and steal hours from workers. All of these things we're looking at are part of building economic security for working families. And finally, we're looking at jobs through Green Jobs Initiative and the expansion of Maryland's renewable energy portfolio, which could create tens of thousands of green jobs right here in Baltimore City. So thank you very much, and I'm at the Communities United table. You can look for me there. Thanks.
We have 3 more